This is the first ever PH Awareness Week. PH is Pulmonary Hypertension. On Monday, you heard me chatting to Iain Armstrong, the chair of the National PH Association. So here we go with the second part of that conversation. If you're moving on from 2 years, PH, this is the first ever PH Awareness Week. PH is Pulmonary Hypertension. On Monday, you heard me chatting to Iain Armstrong, the chair of the National PH Association. So here we go with the second part of that conversation. If you're moving on from 2 years with meds, improving things, what would be a really good outside call now in terms of, surviving with the least impact? Or
the evidence now would be around about 7 to 8 years as an average, and you've got to be very careful in medicine about using statistics.
I know,
because
yes.
It can tell all sorts of things. But as an average, you might be talking about 7 to 8 years.
Okay, that's a big improvement.
It's a massive improvement, and as time progresses, that gets better and better. I think for a number of reasons, new medicines, that's one thing, but I think also crucially how individuals are managed with the condition and how individuals with the condition learn to adapt their lifestyle, because we understand so much more about it.
Yes.
It's a bit like, in a way, diabetes. I mean, diabetes is a much more chronic condition, but because we understand much more about diabetes and can alter lifestyle, adapt to things, then, we can manage it far better as well. So it's a big combination between good healthcare, good relationship with the patients, the family, etc., to get the best out of everything that's available: knowledge, medicine, treatment, all those. So it's a much brighter picture. But still, sadly, it is a condition that can deteriorate. And even in your 30s and 40s and 50s, if you have a condition that could have an average survival of 8 years, that's still quite short.
Yes, of course. Yes.
So it still has, and this is one of the challenges for people with PH and their families and loved ones, is that there's a degree of uncertainty.
Yes.
What is the future like? And that's one of the big challenges,
of course,
of living with a very significant uncertainty in life.
And obviously, for the patient as well, isn't it? Because I've got your lovely little booklet, your pocket guide to PH here, and one of the things you talk about in that is the emotional side of it for the patient, for the the person who's actually got PH. Yeah. Because yes, if you're facing a prognosis and you've got a timeline. I mean, we all have a timeline, but we just don't know where it ends. And
absolutely,
we're lucky that we don't.
And I mean, it is. We become. We're not aware. Our own mortality is not part of our normal conversation in our 30s and 40s and 50s, etc. Even our 60s now, I mean, those types of things. One of the purposes of the Awareness Week this year, in 2016, is being able to talk about pulmonary hypertension, because when people hear the phrase and use, as we started this conversation, PH, what does it mean? It doesn't mean anything specific. It doesn't sound very serious. You said it's to do with the lungs and then the heart. Yeah. If it was a condition that was prefixed, and I wouldn't want this to be misunderstood, cancer, then as individuals we'd know that this is really serious, and we'd be able to have conversations with employees, family members, and say, gosh, this is really serious.
Yes.
We can do a lot with cancer these days. Many cancers are curable. But, pulmonary hypertension doesn't describe this seriousness either. It's only those affected, and when you look into the condition, you think, gosh, this is really serious.
Yes.
And that period of time that we talked about a few minutes ago, this 2 years to diagnosis, when people get a diagnosis, there's often a sense of relief, thinking, oh my gosh, I thought it was something serious. And then you actually, then you start learning, well, it is serious, and, this is why the appropriateness and earlier diagnosis, earlier on treatment, one, the patient feels better and the family feels better because it has a name, and if we can start treating it properly and start trying to control the symptoms. But Yeah, it is. There's many challenges, and that causes emotional sort of problems. Many people, sadly, are not able to work full time.
Yes.
Because the symptoms are so. 1 month they can be feeling really good, 1 week they can be feeling really good, and the next week it's quite impacted again by the symptoms, and so it makes, those types of things different and planning. But it's the ability to plan long term that can cause all sorts of, not unsurprisingly, health issues, emotional health issues, the worries about the future. We all worry about the future in many ways, and then this uninvited guest comes into our life called pulmonary hypertension, and it seems to change everything again.
Absolutely. Well, I know one of your key themes, looking at your website, is to get people talking about pulmonary hypertension.
Yep.
Why do you think people don't?
Because I think they don't understand it, and this year one of our aims with our awareness week this year specifically is people within their family setting, their peer groups, to talk about it. Because one thing that is remarkable about people with pulmonary hypertension, despite the fact it's very serious and the symptoms are very impactful on day-to-day things, if we were to be sat in a coffee shop having a chat and I had pulmonary hypertension and you were I would look really quite normal.
Yes.
There'd be nothing to see. You either look, generally speaking, do you look poorly, do you look unwell, etc. I would if I said, right, I just need to get up and just nip to the bathroom. By the time I'd come back, I was probably quite breathless.
Yes.
And I think also because it's one of those, it's a condition that we don't know about. It is very rare. In the United Kingdom, there's estimated to be around about 7,000 people with this condition, which does make it a very rare condition out of 64 million people.
Wow, yeah.
That makes it really quite rare. And it crosses all age groups. It does exist in children right up to, 70, 80-year-olds. So the likelihood of you ever meeting somebody with pulmonary hypertension is rare.
Yes.
And when things are rare, you don't know what to talk about.
Yeah,
It's this thing about health and well-being, isn't it? How do we don't talk, it seems quite difficult for us sometimes to talk about our health and well-being, because what kind of questions do you ask? And when people think, and one of the things that we also found in some work we did with Manchester University, some interviews, a large interview survey, was that people with pulmonary hypertension often feel quite isolated in their families because they look well at rest and it's a variable condition. Today I feel really quite good, tomorrow I'm very limited. They often feel quite suspicious in the family settings, not all the time, but quite suspicious, thinking, is this real, or are you just, as it were, just exaggerating?
Yeah, so you're just malingering,
Yeah, and that's why we produced the pocket guide, for example. One was, but also in what we would hope in the Awareness Week and at other times, is to be able to have information that describes what pH is in an attractive way, an understandable way, so it was easy to have this conversation.
So is that what you're hoping for then? That's your aim for the Awareness Week?
It is this year, and then build upon it. So we build confidence into people who've got pulmonary hypertension. How do I have the conversation like we're having now? And then, increasing the awareness. But we need people to be able to share the stories, because I know it's a bit of a cliche, but a problem shared is a problem halved, and sometimes it's about understanding, isn't it? It's not, I want to tell you what it's like to have pulmonary hypertension so you can do something about it. I just need you to understand what it's like.
Absolutely.
And, listening to understand rather than listening to react to it.
I like that. Again, that's a great phrase, listening to understand.
Yeah, rather than to respond.
Yeah.
We're very bad at it. It is sadly one of the things, I think this is not a big criticism of healthcare. In healthcare, rather than listen to understand, a lot of healthcare professionals listen and then try and respond and make it better. Well, I just want you to understand what it's like.
Yeah. Well, Iain, thank you very, very much for a very informative chat this morning. Thank you, Iain.
Thank you very much. Thank you.
If you want more information, they do have an excellent website, and that is www.phauk.org.